Let's talk about Sanders classification. Sanders classification is used for intra-articular calcaneal fractures. It is based on CT scan coronal view, and it looks at the posterior facet of the subtalar joint. It depends on how many fracture lines are seen in the posterior facet. More fracture lines means more severe fracture and higher type. Type 1. In type 1 there's no displacement or less than 2 mm displacement. Fracture is present but joint surface is almost normal. It is the least severe form. Type 2. In this type there is one fracture line which creates two fragments only, so posterior facet is divided into two pieces. Subtypes depend on location of fracture line. 2A means lateral fracture line, 2B means central fracture line, and 2C means medial fracture line. Type 3. In this type there are two fracture lines which creates three fragments, so posterior facet is divided into three pieces. Subtypes are 3A means lateral and central, 3B means central and medial, while 3C means lateral and medial. Type 4. In this type there are three or more fracture lines, so posterior facet broken into four or more pieces. This is highly comminuted and has worst prognosis. Hope you've understood the concept. God bless you all. See you in next videos.